Welcome back. You're listening to the Mara Mukwanta Show on Salam Media, and it is time for our last segment for the day, which is our Women's Health Tuesdays. Today, we are talking about gynecological problems or concerns or issues for women in premenopausal stages. And joining me on the line right now is OBGYN, Dr. Tom Mokaya. Hi, Dr. Tom.
Hi, good afternoon, and good afternoon to your listeners.
Thank you for joining me once again.
It's my pleasure.
All right, so Dr. Tom, what are the most common gynecological issues that older women face? And we are talking about postmenopausal women here.
Thank you for having me on the show. Now, one needs to realize that when you're talking about older women, I suppose you're talking about women who have gone into the next phase of their life. And that phase can either be, well, the menopausal stage. And the menopausal stage is a stage where the menopause means the periods pause, the periods stop. So, and that can occur from any age, from the age of 50, take or give 5 years. So from 45 to 55. And there are many, that is why women think that now it's change of life. So life has changed from where one is theoretically able to have children to the stage where they can be able to have children. And many things occur during that phase. And one of the most important things that occurs at that stage is that a hormone called estrogen, the hormone that determines womanhood, as it were, tends to
Yeah.
reduce significantly. So most of these complaints that we see in women at that stage is because estrogen has significantly reduced. And when that happens, one of the commonest reasons why women come to see me is they don't see their periods. And then I say, okay, fine, you don't see your periods. We can do some tests to confirm that they have not seen their periods for a long time and therefore they become menopausal. And that is associated with very many complaints, which one may come with all of them or with some of them. The commoner ones are things like hot flashes. I'm sitting in a meeting and suddenly I break into a sweat. And the sweat lasts for 5-10 minutes and then it goes away and I sweat. And some women can really sweat profusely. So that is one of the one of the commonest symptoms. And there are some who present with other symptoms like they can't be able to sleep, they feel very irritable, they have swings, mood swings, or they could be sitting somewhere and then they feel very sad and they become moody and they become irritable. They are screaming at people. They are not very friendly at that stage. So those are some of the complaints that they have, which are probably psychological, which are associated with what we call as vasomotor symptoms. And there are some symptoms which are specifically associated with the genital organs. These include, I get infections of the bladder very often. When I'm intimate with my partner during sexual intercourse, it's painful, or I'm not interested in sex. There's low libido, and even when we have sex, at times I can bleed. So those are some of the symptoms that one presents with. They come to see the gynae because they are experiencing those symptoms.
All right. And how do these problems affect the women?
Now, normally we look at those symptoms where they are. And some of the symptoms I did mention is that some start experiencing skeletal problems. So what I was going through different systems of the body. So every system of the body may get affected. Like the mood swings are psychological. Pain during intercourse is around the genital area. The skeletal system, the bone system gets affected. So when the bone system gets affected, some women may find that I was chewing a piece of carrot and my teeth broke off. So the skeletal system gets weak. And in severe instances, some women experience osteoporosis, where they are easily predisposed to breaking their joints. And therefore, many systems, once they get affected by the low um, estrogen level, those are some of the symptoms how the women get affected. So, like the lining of the vagina gets very thin, so they bleed very easily during intercourse. And at the end of it all these symptoms can lead into one experiencing irritability. They are not friendly, etc., etc., and all this may require to be treated.
Mhm. What are the symptoms? Or sorry, you have already mentioned that. How is it diagnosed?
Sorry, repeat that again.
How are these problems diagnosed? Dr. Tom, did you get that?
Uh, just repeat. I don't know what happened to the line.
Can you hear me now, Dr. Tom? All right, we're gonna try and catch up with you again. I think the line on your side is not good, but it's okay. We're gonna catch up with you in a moment. For those of you who are listening and watching, we are chatting to Dr. Tom Mokaya about the most common gynecological problems that older women face. These are postmenopausal women, and if you have any questions for Dr. Tom, please leave them in the comments section below. You can also send them to us on WhatsApp. The number is 061 766 0355. And we are also on social media, WhatsApp, Facebook, Twitter, and Instagram. All right, Dr. Tom, are you back? All right, Dr. Tom. Before we lost you there. I wanted to know how are the problems diagnosed? We still cannot hear Dr. Tom. Dr. Tom, can you hear me? All right, not yet. Anyways, ve- although various conditions may affect all women in this age group, the prevalence of certain disorders and also diagnostic approaches and treatment of options may vary significantly when considering very elderly women compared with those early in the sixth decade. The focus, Dr. Tom? All right, Dr. Tom, are you back? Can you hear me? All right, there we
Yes,
go.
I'm back.
All right, are these problems, how are they diagnosed?
Most of these problems are diagnosed by some of them by taking the history. So when one gives you that history, then it will give you almost 50% of what you're looking for. And
Mhm.
then other symptoms like the hot flashes, we do blood tests, and those blood tests will say that particular hormones have gone up and some have gone down. So we do a hormonal profile, and the hormonal profile will
Mhm.
help us in making the diagnosis. And problems like around the vagina, the perineal area, we do a swab, and then once we do that swab, we send it to the laboratory where the cytologists, the people who specialize in looking at this, they will look at it and they will say, oh, the cells here, the particular cells have increased and some have reduced. So some of those are diagnosed by what we call as a pap smear or a vaginal smear. And issues like osteoporosis, is diagnosed by doing what we call as a bone mineral density. There's some specific x-rays which are taken at specific parts of the body, and they will say that the amount of calcium is increased or is reduced. So we have very many forms of diagnostic tools that we use to make that diagnosis. And once we've made that diagnosis, then one can move to the next phase of trying to manage the complaint and treat it.
Yes, let's talk about the treatment. Is there a specific treatment to undergo, or are there any specific medications to take, etc.?
So once the diagnosis has been made, then the health professional or the doctor will decide what will be the next phase that needs to be done. And as we went through some of those symptoms, like for example, the psychological symptoms, they might just require a little bit of psychological treatment without having to take any drugs. So anything that we do without having to take prescription medication, that is called conservative treatment. So we start with conservative treatment. So psychological, that may require a little bit of counseling and explaining to the woman what is happening. Some of them accept it. Some of them, they do accept it, but the symptoms become very severe. Like if, let's say, for example, you are a host like you, for example, you probably don't want to suddenly break into a sweat when you are having a presentation or when you're online, etc., etc. So we give you medication that will reduce that kind of breaking into a sweat. So we give you drugs that reduce that possibilities of sweating. And in women, for example, who have osteoporosis, we increase their calcium medication, um, and and we also give drugs which increase the absorption of calcium. But but the mainstay of treatment in women who have these severe symptoms, since their estrogen level is reduced, one of the best treatment for that is to give them a small amount of estrogen, the hormone estrogen. We call that hormone replacement therapy. So we give them hormone replacement therapy, which is HRT. And HRT is not for everyone. HRT is for once the doctor has assessed the patient, then, and there's no contraindication of the HRT, then we prescribe those hormones called HRT. And most of the time, HRT, and most of the time, that works very well for the women who it is safe to give estrogen replacement.
Now, how often should a postmenopausal woman go for checkup, a pelvic exam, or any other checkups?
Sorry, repeat that again.
How often should a postmenopausal woman go or have a pelvic exam?
Yes, the postmenopausal women should have a pelvic exam because that will help us to assess how the pelvis, as well, what changes have occurred. And pelvic exam is essentially done in two or three ways. Actually, three ways. One is to just look and do observations, which is a physical examination, where one sees whether there are any changes in the skin around the pelvis. Because when the skin starts to change, one may start experiencing, some women may actually develop cancer uh, as age goes by. So examination, just looking and seeing whether there are any color changes. And then one will do a pelvic examination where we put in a speculum into the vagina, which will give us how the walls of the vagina look like and how the cervix looks like. And if there are any abnormalities, then one can either take specimens to try and find out what is happening. And during that time, we also take specimens of pap smears, which are either taken from the cervix and which are also taken from around the vaginal wall. And then after doing those observations, then we do an ultrasound. The ultrasound will show how the uterus looks like, how the lining of the uterus looks like, and look at the uterus, look at the ovaries. Most women who are postmenopausal, we shouldn't find ovarian cysts because ovarian cyst means that the eggs are working. So most of the time, if we find any cysts, we are normally very worried that they could lead into cancer. So a pelvic examination essentially examines all the pelvic organs around the women at that age, and and examinations are actually very critical, and that can be done within either after every 1 year or after 2 years. 2 years is normally one can be able to have time to do it. Having it done every 2 years is advisable all the time to have a pelvic examination.
All right. So thank you so much for your time once again, Dr. Tom. It has been a pleasure speaking with you.
Thank you. Thank you
I
very
hope
much for
our
having me.
listeners can take your advice and go and get their pelvic exams. But for now, thank you and have a wonderful day. That was Dr. Tom Okaya, a specialist obstetrician and gynecologist, talking about gynecological or the most common gynecological concerns in older women. Gynecological concerns in postmenopausal women are common, and although various conditions may affect all women in this age group, the prevalence of certain disorders and also diagnostic approaches and treatment options may vary significantly when considering very elderly women compared with those early in the sixth decade. If you have any comments, please leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. We will be right back.